See the heart beating there on the screen? Angels is really a new concept in healthcare delivery. The concept is that you don't have to be face-to-face with the patient to deliver the health care.
Why were you sent here to see us?
My doctor in my previous ultrasound found some cysts on the brain of the baby.
Arkansas is a very rural state with a few large cities, and the health care is dramatically different from the urban versus rural areas.
You can see the baby's face, the heart beating.
Many of the people, they're poor and they don't have good transportation, so it's impossible for them to travel these long distances. So,
It looks good?
Yeah, it looks fine. The baby's heart rate's a normal rate, and we can see the 4 chambers of the heart even now. This technology, we can virtually go visit these patients where they live and provide the care that they need. We are establishing virtual patient visits using this system. We're doing virtual consults around the state, and we're doing virtual education to all points of Arkansas. Shannon Behringer, genetic counselor, is here, and she's going to talk to you about that, what that means.
The thing that you're at increased risk for, however, just because they saw those cysts, is the risk for the trisomies. And the amniocentesis can rule those out. I've looked at your
Without this technology, I don't know how I would have made it to Little Rock to see Dr. Lowry. There's no way I could afford to take a day off to drive the 3 to 4 hours it would have taken.
We always look for other markers of Down syndrome too, so we look for those.
My baby needs this for her health. I need this to ease my stress level.
This technology allows us to be virtually anywhere. The neonatologists here at EAMS can be virtually present in the hospital prior to the transport of the sick newborn infant.
First thing it does, it helps us to get an overall assessment of how the baby's doing. We can get a lot of visual clues from what the referring physician is thinking.
How's your baby doing?
He's doing okay.
Well, that's great.
So being able to do that is going to be a tremendous help for us.
What kind of follow-up now that I'm back home so far away from the hospital will the baby need?
It allows us to make critical and time-sensitive decisions about patients from outlying hospitals.
I appreciate you talking with me. It saved me a big trip.
You might think of this as the nervous system that allows us to make the connections. Through this technology, we can be virtually anywhere, anytime. You know, it's very gratifying to be a part of something like that.